Hello, I'm Dr. Roy Picard, and I created this video for the residents of Clinton Township, Michigan. And what I'm going to discuss are the different types of tests that are often overlooked when it comes to helping the child who has either been diagnosed as having ADHD or suspected of having ADHD. Now, what I want you to understand is that brain function is the most important thing that needs to be addressed with these kids. In some of my earlier videos, as well as the information on the MichiganADDADHD.com website, I talk about the functional disconnection syndrome, which is common to all of these kids, and how important it is to get the brain balanced. And brain function does depend on two things, both stimulation and body chemistry. The body chemistry has to allow for proper fuel to the brain in order for functioning of the brain at its optimal level. So how do I determine which areas of the brain require additional stimulation? There are specific non-invasive tests which are geared for specific age levels that will tell me which areas of the brain require additional stimulation. Some of these tests will assess if there's a visual processing problem, an auditory processing problem, a motor skills delay, a lack of coordination, perhaps there's a problem with timing or rhythm, any deficiencies with fine or gross motor skills, and there's much more. As far as the body chemistry evaluation or the metabolic analysis, again, it's dependent upon the child's ability, but we may need to evaluate such things as blood sugar, cortisol levels, the amount of good bacteria in the gut. If there's any bad bacteria or fungus or parasites, we may want to look at even thyroid function or assess how well oxygen is getting to the brain. We can look to see if there's a high count of bacteria or virus. We can check iron levels, liver function, immune system function, kidney function, and much more. What I want you to understand is this. There's a great deal that can be done for these kids, but unless you're getting the right types of tests, unfortunately your child will not have the opportunity to reach their optimal physical, mental, social, emotional, behavioral, or academic level of performance. Also keep in mind that these particular tests that I'm speaking about, they do need a functional assessment as opposed to just the traditional medical analysis. For more information, you can go to Michigan ADHD, and if you're interested in setting up a free consultation, then call my office at 586-726-9860 and talk to the staff about scheduling a free consultation so that we can sit down and talk and discuss what potential is there to improve your child's function. Again, I'm Dr. Roy Picard. I wish nothing but the best for you and your child.